What if I told you that there is a natural supplement that is subtly changing the rules about blood pressure, diabetes, and stubborn belly fat, and that almost no one is discussing it? Think of something that turns on your body's secret switch that keeps your heart young, burns fat, and balances sugar. Physicians refer to it as nature's metformin. However, its effects are significantly more extensive than any prescription. It's not hype. It's the application of pure cellular science. Could this be the missing component that your body has been longing for? Let's find the best supplement that melts belly fat, lowers blood pressure, and eliminates diabetes. Let's get started. Alpha-lipoic acid is the first. Doesn't alpha-lipoic acid sound nearly enigmatic? Every cell in our body contains a tiny chemical that can subtly alter how we burn sugar, regulate blood pressure, and even melt away fat that won't go away. It is referred to as the universal antioxidant by scientists, and the explanation is straightforward. It protects every part of our body from harm and functions in both fat and water. Alpha-lipoic acid deficiency causes people to feel exhausted easily, have nerve tingles, impair their eyesight, and heal wounds slowly. Your cells seem to lose their luster. Generally speaking, a deficiency indicates that your body has trouble using glucose appropriately, which results in increased insulin resistance and a slower metabolism. People over 60 and those with type 2 diabetes are particularly affected, as their natural production of glucose decreases by over 40%. But how exactly can alpha-lipoic acid aid in the eradication of diabetes? Let's go right to the point. According to clinical studies, it can reduce fasting blood glucose in diabetics by roughly 15 to 20% and increase insulin sensitivity by up to 27%. It functions by turning on a metabolic switch that, even in the absence of insulin, enables our muscles to extract more glucose from the blood. This results in a more balanced release of energy throughout the day and fewer blood sugar rises following meals. According to research from the National Institutes of Health, taking 600 mg of alpha-lipoic acid daily can lower HbA1c levels by 0.7 to 1.0%. This is almost as effective as certain oral diabetic drugs without having as severe of a negative impact. Imagine not seeing your blood sugar rise after eating a meal. That is this compound's subtle brilliance. Alpha-lipoic acid uses a cunning trick on our metabolism to help us lose tummy fat. It helps the body convert stored fat into useful energy by increasing the activity of mitochondria, the cell's internal fat-burning engines. Participants in a 24-week US trial of overweight individuals who took 600 mg daily lost up to 4.8% of their body weight, the majority of which came from belly fat. Additionally, it reduces leptin, a hormone that is frequently elevated in individuals with insulin resistance and abdominal fat. Your body begins to recognize fullness signals again when your leptin sensitivity improves, which causes you to eat less naturally without the need for diets. The interesting part of the narrative comes when it comes to blood pressure. By raising nitric oxide levels, alpha-lipoic acid increases artery suppleness. By relaxing and widening blood arteries, this chemical lowers systolic blood pressure by an average of 8 to 11 mmHg of mercury. That tiny decrease can result in improved kidney protection and a 20% decreased risk of stroke in those who have both diabetes and hypertension. Additionally, it keeps blood vessels smooth, elastic, and clean by reducing oxidative stress inside them by about 50%. This eliminates the need for the heart to work hard to pump blood. This vitamin is beneficial to all of the body's organs. Because alpha-lipoic acid promotes the repair of myelin, the protective layer that surrounds nerves, the healing process is accelerated. For diabetic neuropathy, when walking is unpleasant due to tingling and burning in the feet, neurologists in the US frequently suggest it. After just 3 weeks of taking 600 mg daily, 71% of patients in one research trial reported a significant reduction in their nerve pain. Because it prevents protein leaks and maintains globular function, the kidneys also adore it. The microscopic filters that protect the eye's blood. It slows the evolution of diabetic retinopathy by reducing oxidative damage in the retina. In patients with fatty liver disease, alpha-lipoic acid reverses fat accumulation and encourages detoxification, so even the liver benefits. Because the natural food supply is limited, supplementing becomes crucial after the age of 50. Smaller levels, however, are present in organ meats such as cow liver, 0.5 millimoles per 100 gram, spinach, 0.3 millimoles per 100 gram, broccoli, 0.2 millimoles per 100 gram, tomatoes, 0.2 millimoles per 100 gram, and Brussels sprouts, 0.15. These quantities, however, are insufficient to address deficiencies or provide therapeutic advantages for blood pressure or diabetes. Supplements really help in this situation. Doctor's Best alpha-lipoic acid 600 milligrams is among the top 5 alpha-lipoic acid supplements in the United States, renowned for its clinical efficacy and quality. And Thorn alpha-lipoic acid 300 mg, pure encapsulations, Nature's Bounty alpha-lipoic acid 200 mg, and Now Foods alpha-lipoic acid 600 mg. The majority of doctors advise taking 300-600 mg daily, usually in 2 doses for optimal absorption. It functions more quickly when taken half an hour before meals because there is less competition from food. To further improve glucose metabolism and guard against biotin insufficiency, which prolonged use can induce, some U.S. endocrinologists advise taking it in conjunction with 150 micrograms of biotin. Since glucose variations are greatest in the mornings and afternoons, these are the optimum times to take it. After 2 to 4 weeks of regular use, many users report a discernible decrease in their blood sugar levels. However, because it can slightly increase energy and disrupt sleep, it is not recommended for first-time users to take it before bed. Most individuals should take 600 mg per day. However, those with severe neuropathy or high blood pressure should only take 200 mg under a doctor's supervision. Let's now discuss the opposite side effects of overdosing. Muscle cramps, exhaustion, low blood sugar, and nausea can result from taking more over 1,800 mg daily. In rare instances, hypoglycemia may occur if insulin or oral diabetic medications are taken concurrently. In addition to lowering thiamine and vitamin B1 levels, extremely high dosages may cause disorientation and exhaustion. Because of this, the majority of U.S. physicians advise taking a B-complex vitamin if you want to use alpha-lipoic acid for an extended period of time. However, because it can slightly increase energy and disrupt sleep, it is not recommended for first-time users to take it before bed. Most individuals should take 600 mg per day. However, those with severe neuropathy or high blood pressure should only take 200 mg under a doctor's supervision. Let's now discuss the opposite side effects of overdosing. Muscle cramps, exhaustion, low blood sugar, and nausea can result from taking more over 1,800 mg daily. In rare instances, hypoglycemia may occur if insulin or oral diabetic medications are taken concurrently. In addition to lowering thiamine and vitamin B1 levels, extremely high dosages may cause disorientation and exhaustion. Because of this, the majority of U.S. physicians advise taking a B-complex vitamin if you want to use alpha-lipoic acid for an extended period of time. Berberina. This little golden compound, may be the secret weapon your doctor never informed you about, even though you may not have heard anything about it. It is located deep within plants like golden seal and berberine, and it has quietly gained a reputation for accomplishing tasks that many pricey medications find difficult. Reduce blood pressure, melt belly fat, and eradicate diabetes. It seems too good to be real. Let's examine how something so natural can have such a profound impact on our bodies, particularly for Americans who battle daily blood sugar fluctuations and stubborn obesity. When the body's supply of berberine is depleted, odd things begin to occur. Blood sugar swings wildly, energy dumps hit harder, and belly fat won't go away no matter how much you exercise or eat. After meals, a lot of people start to notice that hazy, exhausted feeling, the dull ache of elevated blood pressure, or the gradual increase around their waist. Insulin resistance, a condition in which cells inside the body lose their capacity to react to insulin effectively, causes glucose to remain in the blood for prolonged periods of time, gradually harming the heart, kidneys, and nerves. Berberine acts as a metabolic reset button in this situation. M-activated protein kinase is a unique enzyme that is activated by berberine once it enters the body. Consider it the energy controller inside of you. Slow cells are awakened by this enzyme, which instructs them to consume sugar for energy rather than storing it. It's fatty. Berberine has been shown in studies to increase insulin sensitivity by as much as 30%, which speeds up the absorption of glucose by your muscles. Many diabetics experience a 20-25% decrease in their fasting blood sugar in a few weeks. However, those harmful post-meal blood sugar spikes frequently decrease by 30%. HbA1c levels can decrease by around 1% over a 3-month period. A result powerful enough to compete with certain prescription drugs. Additionally, the body begins to relax when blood sugar levels stabilize. And kidney function improves, heart strain diminishes, and nerve pain subsides. Here's something interesting now. By relaxing the arteries, berberine improves circulation and lowers blood pressure by 8 to 12 millimeters of mercury at the systolic and 5 to 8 millimeters at the diastolic levels. That's a subtle but effective change that reduces the strain on the heart and avoids those risky morning spikes that frequently cause heart attacks and strokes in the elderly. The story doesn't end there. In just 12 weeks, berberine can help melt away 3 to 5% of abdominal fat by stimulating the liver's and muscles' fat-burning enzymes. Imagine your body using stored fat for energy once again, and that stubborn stomach finally softening. Each organ appears to express gratitude to berberine in a unique manner. Liver enzyme levels drop by over 30% as the liver starts to eliminate extra fat. Triglycerides decrease by 15% and LDL cholesterol by 20%, which relieves the heart. With protein leakage decreased by roughly 12%, the kidneys, which are continuously taxed by elevated blood sugar, begin to filter waste more effectively. Even the nerves, which are frequently the first to suffer from diabetes, react well. After consistent use, many individuals report a 10-15% reduction in tingling and burning symptoms. Additionally, berberine balances good bacteria in the gut, avoiding the post-meal spikes in blood sugar that cause fatigue and weakness. However, where can one truly locate this miraculous molecule? A few rich sources are found in nature. Each serving of berberine contains roughly 1.5 Gr. 1 gram is provided by golden seal root. 0.8 G of Chinese gold thread is available. The Oregon grapefruit yields 1.2 grams. Additionally, tree turmeric contains about 0.9 Gr. The issue is that it would be practically hard to achieve the quantities utilized in research with food alone. you would need to consume vast amounts every day. Because berberine supplements make dosage easy and predictable, the majority of individuals in the USA rely on them. Norn berberine, 500 milligrams, is one of the greatest alternatives available on the US market because of its high absorption and purity. Now, Food's 400 milligram berberine is reasonably priced and well known. Berberine 500 milligram from Gero Formulas is commended for managing diabetes. The finest Dr. Pure encapsulations with 500 milligrams of berberine are excellent for heart and lipid balance. Professionals like 400 ml of berberine because of its pure formulation. The majority of specialists advise consuming 900 to 1,500 ml daily, split into 2 or 3 dosages, before to meals. Time is of the essence. It helps maintain stable post-meal glucose levels and slows the absorption of sugar when taken before meals. Within 4 to 6 weeks, people who maintain consistency typically notice an improvement. Reduced cravings for sugar, lighter midriff, and more consistent energy. Here's the catch, though. When something is too nice, it can backfire. Taking more over 2,000 berberine daily might result in diarrhea, cramping in the stomach, and periods of low blood sugar that make people feel lightheaded or unsteady. Rarely, heavy use can cause liver stress. Additionally, berberine may intensify the effects of some drugs, including insulin, metformin, and blood thinners like warfarin. Therefore, it's crucial to speak with a physician before mixing them. High doses can impact fetal development, thus pregnant and lactating women should completely avoid it. The fact that berberine enhances general metabolic equilibrium only adds to its allure. It lowers the risk of heart disease by 15% by reducing C-reactive protein, a key indicator of inflammation. Additionally, it increases vascular flexibility, which facilitates unrestricted blood flow through even the tiniest capillaries. Because their blood sugar no longer drops after meals, people frequently report feeling lighter, calmer, and more attentive. Consistent use improves internal function and external look over time by reducing visceral fat, the harmful type that surrounds organs. This transition can feel like a life-altering experience for people over 60. Imagine waking up without a headache in the morning, not having swollen feet, and not feeling drained and heavy after eating. That's how healthy blood flow and balanced insulin feel. By improving each cell's response to insulin, lowering blood sugar levels, and allowing the heart, nerves, kidneys, and liver to work more easily, berberine helps to achieve that balance. The body's natural energy producers, the mitochondria, are even increased, giving you extra energy for daily chores and preventing lunchtime slumps. Berberine is most effective when combined with lean protein, omega-3 fatty acids, from fish like salmon or cod, and a diet high in fiber. Better insulin sensitivity, easier digestion, and heart protection are all supported by this combo. Many Americans with diabetes who use this method have improved HbA1 levels near 6.2%, 2%, indicating true metabolic recovery, and more stable fasting glucose levels, around 90 to 100 mg/dl. The secret is consistency. Berberine taken at the same time every day avoids sharp decreases in blood sugar and maintains predictable patterns. Third, extract from cinnamon. The name alone may conjure images of steaming coffee or sweet buns. But what if this spicy spice that you might be concealing in your kitchen cupboard had the power to melt stubborn belly fat, lower blood pressure, and even eradicate diabetes? Yes, exactly. The kind of strength that most people hunt for years may be found in something as commonplace as cinnamon. Cinnamaldehyde, the natural ingredient that gives this spice its reassuring scent, is found deep within it. Surprisingly, when you take it properly, your body undergoes some of the most incredible transformations. You may not realize it right away when your body isn't getting enough of these cinnamon compounds, but gradually, the balance begins to change. Sugar starts to stay in your bloodstream longer than it should because your cells stop responding to insulin signals. After meals, you start to feel heavier and more exhausted, and you might even start craving sweets to get your energy. That is your body's unspoken call for assistance. Preliminary indications of insulin resistance. However, as soon as cinnamon extract reaches your bloodstream, your cells experience an almost electrifying sensation. It instructs your insulin receptors to become active, which enables glucose to enter your bloodstream smoothly rather than idly floating around. Studies reveal that insulin sensitivity improves by around 30% in a matter of weeks. A 20-25% decrease in fasting glucose, and a 30% decrease in the abrupt post-meal surges. People start to notice more stable energy, less sugar crashes, and improved cognitive function. Long-term sugar control is shown in HbA1c levels, which can decrease by 0.9 to 1.1%. A change powerful enough to rescue a large number of people who were not yet diabetics. However, blood sugar is only one part of the story. Like a natural artery relaxant, cinnamon extract has the odd capacity to reduce inflammation and enlarge blood vessels. As a result, blood pressure drops by 6 to 10 mmHg of mercury, blood flow becomes smoother, and the heart experiences less strain. That is significant for elders. Less morning surges that cause heart attacks and strokes are the result. In the meantime, cinnamon begins to remove the unhealthy cholesterol accumulation inside your arteries. LDL values decrease by roughly 15%. By 20%, triglycerides decrease. The good cholesterol, HDL, also increases by 10%. Blood flows more freely as a result of that alteration alone, delivering nutrients and oxygen to every part of your body. Additionally, as blood pressure decreases, your kidneys breathe more easily and filter waste more effectively, and your nerves, which are frequently harmed by diabetes, start to feel warm and sensitive again. After a month or two, many people even say that the tingling in their feet stops. This is when things start to get interesting. Cinnamon dissolves belly fat in addition to controlling blood sugar. It increases thermogenesis, the process by which your body burns calories to stay warm. Deep visceral fat, particularly around the waist, is broken down by that mild metabolic fire. Consistent usage of cinnamon extract over 3 months can reduce resistant belly fat by approximately 3 to 5% and waist circumference by up to 5%. Insulin resistance also begins to decrease when that internal fat decreases. The old energy slumps begin to go, the body feels lighter, and digestion gets better. Cinnamon seems to be the signal your metabolism has been waiting for. Pastries with cinnamon sugar don't work their magic. It comes from its potent extract. The highest concentrations of cinnamon found in nature can be found in Ceylon, 1.2 gr of cinnamon aldehyde per 10 gr, Cassia, 1.88 gr, Saigon, 2 g, Korea, 1.5 gr, and Indonesia, 1.6 gr. Because Ceylon cinnamon, also known as real cinnamon, is naturally low in coumarin, a substance that can damage the liver when taken in excess, it is the safest of all of these for everyday usage. Despite being stronger, Cassia cinnamon should be used with caution since it can accumulate too much coumarin over time. Supplements with pure Ceylon cinnamon extract are thought to be the best option for long-term diabetes support because the majority of Americans use it without realizing it. The strength and purity of the best supplements in the USA are noteworthy. One of the most reliable supplements for blood sugar regulation is Nature's Bounty Cinnamon 1000 $. Cinnamon bark 600 mg now aids in rapidly lowering post-meal increases. Two potent glucose regulators are combined in Swanson cinnamon chromium complex, 500 mg, to provide more seamless sugar regulation. For people with recalcitrant fasting glucose, 2,000 mg of Carolee cinnamon complex is excellent. Additionally, Nutrifleur Ceylon cinnamon 1200 mArs is recommended due to its mild and safe formula for the liver. The majority of doctors advise taking 1,000–2,000 mg per day, divided into 2 doses, 15 to 20 minutes before meals. This timing helps prime cells to use glucose more effectively and prevents the gut from absorbing sugar. Within a few weeks, those who follow this pattern frequently see stable fasting sugar levels, around 95 mg/dl, and post-meal readings between 120 and 130 mg/dl. However, too much of a good thing can make things go wrong. Mild liver discomfort, low blood sugar episodes, and stomach cramps can result from taking more over 3,000 mg daily. If taken on an empty stomach, some people may experience nausea. Because cinnamon can intensify the effects of blood thinners, such warfarin, insulin, and metformin, those taking these medications should see their doctor. Because high dosages may promote uterine activity, pregnant women should limit their intake to minimal meal-level levels. However, when used as directed, cinnamon extract continues to be one of the safest and most well-tolerated natural substances available. The fact that cinnamon makes every system feel younger is really exciting. It causes a 12% decrease in C-reactive protein, reducing inflammation throughout the body. It improves vascular elasticity and helps arteries restore their flexibility, which prevents the heart from working over time. By shedding extra fat, the liver reduces enzyme levels by roughly 25%. When blood sugar levels stabilize, the kidneys are better able to remove waste. Neuropathic pain is reduced by around 15% as the nerves become more sensitive again. Additionally, cinnamon increases the uptake of glucose by neurons, which sharpens the brain and enhances short-term memory and focus. After years of fog, many seniors say they finally feel awake. Cinnamon functions as a traffic controller inside the gut. In addition to preventing glucose excess, by slowing down the breakdown of carbohydrates, it promotes the development of good bacteria that aid in blood sugar regulation. Reduced hunger spikes, less bloating, and calmer digestion are all benefits of gut health. Cinnamon extract is considerably more successful at controlling sugar and lowering cholesterol when paired with a diet high in fiber and good fats. Many diabetics in the United States who incorporate it into their daily regimen report lighter sleep, cleaner skin, and more stable moods. All indications that oxidative stress and inflammation are at last subsiding. Just wait until you see what comes next if this potent pill surprises you. Don't allow high blood pressure, diabetes, or abdominal fat to rule your life. Today, take command. As we reveal more natural secrets that revitalize, heal, and alter your body from the inside out, hit the subscribe button, activate the notification bell, and come along.